My training is in developmental pediatrics, so it means children with disabilities, and I came across a patient with Krabbe disease. And the mother came to me, and the first thing she told me was, please do not tell me there is nothing we can do about my daughter who's going to die, because I've heard that from all the doctors, and you have to realize I'm a mother, and to tell that my almost normal-looking child is gonna die. It's a journey, and I don't want to live that journey alone. So that gave me a lot of thought, and I thought, oh my God, what a bad job we're doing as doctors to tell these patients to go home and enjoy your child.
Dr. Escolar is the person with the most experience in this disease, and she's still easy to talk to through it all, and she provides sympathy and empathy, which a lot of providers don't have when they're treating kids with terminal diseases, and she provides a sense of hope, which is what you cling to when you're given a diagnosis like this.
The whole reason why I started this project was because of a patient, and for me, patients always go first. And obviously, when we have a therapy like this completely changes, the scenery in terms of hope, because now you can hope for a totally normal life.